So my presentation is about the use of AI for the automatic diagnosis of lung conditions. The diagnosis of lung conditions using digital technologies consists mainly of three main steps. So the first one is to prepare the image, the medical image, for further processing. That is noise suppression in particular, smoothing out the image, preparing it for subsequent stages. The second one is very important. That's radiomics, which is about the extraction of visual cues or visual features from the image, that is regions of interest. And then the last one is the use of AI for stratification or classification of the underlying condition. So I may take each one of those three steps and perhaps spend a couple of minutes explaining what it is all about and giving you some results of recent research findings that we've recently. So images, medical images exist in different modalities, as you know, one of which is ultrasound. Ultrasound is particularly challenging because mainly of the speckle noise, which is in the image. It makes the image a little bit pixelated and indiscernible. So even to the trained eye, the healthcare professional struggles to interpret the content of the image and to diagnose the underlying condition. So what we normally do is to apply very efficient filtering techniques to try to suppress that speckle noise that exists in the ultrasound image. Now, you see in the top middle part of the image, that image there is the original. That's the one that comes from the ultrasound scanner. But then applying different types of filtering techniques, you see the image has been smoothed out. For instance, if we use the median filtering technique, see the top left image has been a little bit cleared up from the background noise. If we use wavelet filter, the top bottom image, again, you see a different type of noise suppression has been applied on the image to make it smoother. Now, in our experience, in our research, we've concluded that the two most efficient filtering techniques on the image, which have resulted in the best perceptual quality, is what is referred to as CLAHI, the histogram equalization technique, and the block matching 3D technique. Now, what you see on the slide here is the original to the left, but then the one in the middle is the image after histogram equalization has been applied. And the one to the far right is the block matching. See how smooth and clear the image has become? Although it's a little bit blurry due to the fact that high frequency has been taken out in a very dramatic way on the image. So it's become really smooth but blurry. Now, so there is a trade-off here between suppressing noise and keeping some important information in the image, which would be necessary for subsequent stages. The second part, the second step, is about radiomics. What you see here to the left is actually the raw image. It's an X-ray, this one, of a 12-year-old child that's been diagnosed with COVID-19. Now, we do low-level processing, that is going into the image content, pixel by pixel, in order to identify features which might be relevant for the AI model to classify the underlying condition. So, for instance, intensity level, the distribution of intensity values in the image, the actual density of the intensity level, etc. Those will be detected during the processing process. And what you see to the right, sorry, here, these circles indicate where these regions of interest have been identified in the image. Now, those regions of interest would be absolutely important for the AI model at the final stage. So these would be used to train the model to recognize the underlying condition. Here is another example of a COVID-19 case for an adult, in this case, against an X-ray that shows the raw image to the left, the image after improvement, preparation, there's filtering, brightness enhancement, contrast enhancement, etc. And then the image to the right is after radiomics has been applied and visual cues have been identified. So the algorithm is about multiple steps, as it shows from top to bottom in logical order. Starts with analyzing the image, extracting the cues from it, then doing the machine learning before passing it to the stratifier or classifier, as it is known in computer science terminology. A classifier is what really determines what the underlying condition is. And the final outcome will be either lung cancer, for instance, or COPD, the chronic obstructive pulmonary disease, or pneumonia, or CV19, or indeed other lung conditions as well. So this has attracted, this algorithm has been validated in our lab experimentally. We're going through the clinical validation as we speak in order to integrate it into the clinical pathways. We are in talks with one of the NHS trusts in West Midlands to do that. So it has really attracted a number of media attentions, where you see that Medical Express has released a press, a media outcome about it, output about it. You see there, this is captured, has been captured in one of the articles by Medical Express that is titled AI Auto Scans Lung X-rays for Coronavirus. So what's really unique about it is that it is wide in terms of its diagnostic range. Existing solutions normally focus on one or two conditions at most. Our innovation can classify a range of lung conditions, including lung cancer and COPD, that cost the NHS £11 billion, by the way, annually, in terms of diagnosis and treatment. So it's quite a fat bill. And this innovation is aiming to try to help the NHS, reducing queuing delays and expediting the health outcomes. Another unique selling point about it is that it can handle more than just one imaging modality, unlike existing solutions, which normally focus on one, X-ray or CT or maybe MRI. Our innovation can handle a range of imaging modalities regardless. It has achieved really high classification accuracy. We've achieved over 95% accuracy in terms of determining the underlying condition successfully. That's positive outcome. I've just won a Smart UK award for this, to go through the clinical validation process, but also to achieve compliance, regulatory compliance, before integrating it into the clinical pathways. And we are in collaboration with our innovation partners, SCC, who are our strategic partners here, to help us integrate the technology into the clinical pathways of an NHS trust. Right, so this is as far as diagnostics is concerned. Now, another area where AI can be used for lung condition processing is for the detection of the pleural line. Pleural line is certainly a very important feature in lung images, and hence for the radiologist, seeing whereabout it is in the medical image is of extreme importance. So how to automate the process of detecting pleural line is what this study was all about in ultrasound images. So that could be done at preclinical stage. You don't expect the patient to have to queue up for long periods of time before having access to a sophisticated scanning machine like X-ray or the like, but it could be done really at preclinical stage without having to go through health and safety risk of radiations, because ultrasound is very much reliant on electromagnetic waves. So the algorithm is about multiple steps here. It starts with despeckling the image, that's removing the speckle noise, then improving the contrast, and then segmenting out the regions of interest before applying rectangular convolution on the image, so that those regions of interest will be, and then a bounding box algorithm to detect the contour in the image before finally the pleural line is identified. So this is what we've done here. We've split the ultrasound image into a number of vertical slices, as it shows in the image in the center here. And then we've applied what is known as HMM, which is Hidden Markov Model, which is a well-established technique in computer science, in image processing in particular, widely used in image processing, in order to model the bright intensity regions of the image. Because the pleural line normally is situated in areas which have very high intensity levels. So detecting the bright intensity regions of the image would be very helpful. So we've used this HMM model to locate where the bright intensity regions in the image are. And then we've used vector analysis, VA, in order to predict where the linear structure in the image is, because we're detecting pleural line, and the linearity of the region of interest could be exploited here in the prediction process. So we've used VA for that, which is again another established technique in the field, vector analysis. And this has given us a very good estimate of where this pleural line could be due to the linearity of the structure. And then this has given us quite good results, as you could see in these images here. The set of images to the top show the red line, which indicates where the pleural line has been identified in the ultrasound image. And the set of images to the bottom, these are the segmented images, after ignoring anything that comes over the line, the pleural line. So you see anything that comes above the pleural line has been blacked out, leaving the region of interest that is below the pleural line. This is quite an accurate detection, you would agree, of the pleural line in the ultrasound image, despite the challenging nature of this modality. So as observations to these two pieces of research that we've conducted using data analytics and AI, the combination of image analysis and AI could really generate high diagnostic accuracy, as was just demonstrated in the subjective results I have presented. The technology could also be transferred to other conditions, to other parts of the body, not necessarily just the chest or the lung conditions, but could be applied to the head structures, to heart as well, to diagnose cardiac diseases or things to do with the head as well. But of course, the image analytics and the AI will then have to be adapted to these conditions. Our technology could be applied in single image mode, but could also apply in batch mode. And this is very, very important, because you may come across a situation whereby radiologists do have a backlog of images to go through in order to diagnose the underlying conditions. So you can feed a batch of images, like 1,000 or 2,000 images, into this platform, and then you get a report that gives you the summary of all the underlying conditions in each one of those images in the batch. And this certainly leads to reduced delays and improved health outcomes. Thank you very much.
Okay, well, thank you very much, Abdul. I found that absolutely fascinating. My partner suffers from COPD, and she was recently admitted into hospital in Northampton when she had an exacerbation. So she's had the MRI scans, and I can see from the images that you presented in your presentation that it is not it is far from trivial to be able to actually detect the conditions, so simply from an image alone. I just really have one question. You mentioned the 95% degree of accuracy. How does that actually compare with the accuracy of skilled radiologist, or is it an unfair comparison?
Okay, the technology is by no means expected to replace the role that radiologists or radiographers perhaps play in the whole ecosystem, but it is really an assistive aid. It's something that would be like a second opinion But more importantly, it is there to expedite the process, because we know the resources of the public health system have been absolutely swamped over a certain period of time. And we know that they're over stretched in terms of their ability to cope with the huge level of pressure that is being applied on the system. So this technology would help them go through the diagnosis process in a quicker way, reducing the delays in having patients to get diagnosed before a certain treatment plan is put together for them. And it could be done at a much early stage in the process, so they don't have to wait until a certain X-ray or CT scan is produced, which I know is very much under pressure. But it could be done at preclinical stage, even in a certain practice where you got an ultrasound scanner. So an ultrasound image could be produced and then put into that system for a diagnosis report to be produced.
Well, thank you very much for your presentation. I find it absolutely fascinating. I'm sorry you're not able to be with us in person, either in person in London or online, but wish you all the best with our research, and thank you for your contribution.
Thank you very much. Enjoy the rest of the Congress, everybody.